Oh, I'm attacking people. I'm so sorry.
No, you're okay.
Okay.
Stacy.
Yes.
Could you run down to the clinic and see if Dr. Pickett is willing to come out?
Okay.
Because he was interested in doing it on emergency. I just don't have his.
You guys good with this? Maybe I shouldn't even touch
Yeah,
it.
yeah. There you go. There you go.
So you were at Thanksgiving wedding, huh?
Okay. And that makes it really easy to remember too. I thought the scrubs would make it. No.
Those guns are too big to pull up the bag. Come on.
See if you can find my belt over here.
Dr. Holland, you said before it was 600 initial doses you got? Or is it?
Approximately.
Approximately 600. When do you, just to confirm, the 2,100 you mentioned that you expect to get soon, how soon would you get that?
I'm not sure. I would hope before Christmas, but it's kind of just being shipped out in little allotments. So they haven't been very specific about it.
Has the state health department given you any information about the total number of doses that will be available in the first round?
Yeah, well, we know that our initial allotment of, or initial request of about 2,700 doses will be filled eventually. The first however many doses the state received have all been allocated.
And how many were there, do you know?
80,000?
84,000. Is that what you heard? I heard 84,000?
Something like that, yeah.
Yeah, okay.
Pfizer about 84,000.
Okay, thanks. Has that arrived here, or has it just been allocated?
They've all been allocated. I'm not sure. I can't speak to whether the actual arrival at each of the health departments.
Okay, thank you.
All right.
Yeah. That's all done. Here we go.
Thank you, guys.
Of course, they get Yeah. You don't have an extra shot, do you? Yeah. Thank you.
Holland. I'm the Chief Clinical Officer at the Fulton County Board of Health.
Dr.
David Holland, yes.
So tell us first what's going to happen here this morning.
Okay, well, so we just received our first shipment of the COVID-19 vaccine. And so we are going to get started vaccinating people, is really what it boils down to. We are following the guidelines issued by the American Council on Immunization Practices on priorities for vaccinations, and healthcare providers are in that Tier 1A that we're being asked to vaccinate. And so we are going to get started here at the Board of Health with our testing staff is our first priority. People involved in our testing activities at our spot sites, the people that will be doing the vaccines, as well as EMTs that are our first priorities here.
Doctors, nurses?
Doctors, nurses, and then some support staff that have direct contact with patients as part of that.
How many doses do you have?
Right now, we only have right at 600. That's that's just the first little trickle.
And are those all for the Board of Health here?
Well, not just the Board of Health, but Board of Health, our testing partners, emergency medical technicians, and then the next group is going to be doctors, nurses, healthcare providers that are not associated with large medical practices. So groups like Piedmont Hospital, Grady will be vaccinating. They'll get their own supply for their staff. But there are obviously a lot of doctors and nurses that are not associated with large medical practices that are unable to get vaccine for their, they're not able to handle the vaccine in the way it comes. So we will be vaccinating those individuals.
Did y'all ask for more than 600?
We did, and we're going to get more.
How many more do you expect to get?
Well, so
This month?
Yeah, so we expect to get about another 2,100 in our first request, but we're able to order more.
How do you decide who the 600 go to today?
Well, we're not going to be able to do 600 today. It's,
Okay.
this is, today is about, is really about practice, honestly. It's making sure that our safety protocols are, and this is not a usual vaccine. It has to be stored in certain ways. So we need to be sure that we have our SOPs down before we roll it out to the testing sites tomorrow.
Excuse me, we have our district health director, Dr. Lynn Johnson.
I'm not here to interrupt, please, continue.
How many are we going to vaccinate today?
Probably 5, maybe 10 people.
And how long would it take to do the 600 doses?
Not as long as you think. It depends on primarily how many people we have vaccinating, but we're planning on vaccinating about maybe 300 or 400 people over the next week as we get ramped up. And then we're getting additional staff to help us with the bandwidth. It's really about having enough people able to vaccinate.
What is the anticipated need in Fulton County, the number of people that would qualify for the vaccine? And we're talking about thousands, and obviously it's the medical care, healthcare workers.
Well, ultimately, everyone will qualify, and that's 1 billion people. It's the people that qualify right now. It's not really about qualifying. It's about priority. Who's at the most risk of acquiring it, and who's at the most risk of dying for it. The other group of people that are in this tier 1A, this top tier, are long-term care facility residents and staff, because they've been very hard hit. So this isn't a matter of qualifying or not qualifying. This is just a matter of rolling it out in order of danger.
Priority,
Yeah.
There's still some lingering skepticism, kind of your message on the safety of the vaccine.
The vaccine is very safe. It's the safety profile for this vaccine is roughly equivalent to another commonly used vaccine called Shingrix, which has local reactions and a handful of people that end up with fever and so forth. There have been some reports, some very rare reports of people with more severe reactions, allergic reactions and so forth. These are very, very rare and seem to be mostly or entirely in people that have had other severe allergic reactions. So anybody that reports that, we're obviously going to monitor very closely, but so far there's not been any group that's been absolutely contraindicated for the vaccine.
So could you run down the list real quick, summary, who's in line, how is this going to roll out?
Yeah, so I'm need to do this by memory. In the tier 1A, there's 1A, B, and C. 1A is healthcare providers, long-term care facility residents and staff. Tier 1B tier 1B is public safety, the rest other public safety other than EMT, so police, fire, so forth. Other critical infrastructure worker, and there's a long list of that, as well as people over the age of 65 who have comorbid medical conditions that raise their risk of getting COVID, or of having severe COVID disease. Tier 1C is people over 65 without comorbid medical conditions, or people under 65 with comorbid medical conditions, so people with HIV, cancer, immunosuppressive conditions, other things that would make them have severe reactions. In phase 2, we have shelter residents, jails, the inmates, other people in congregate settings that are at increased risk of acquiring COVID, and then they start adding in different age groups as you go down the line.
Okay. And just to be clear, the 600 doses, that's 300 people of that first batch, right?
No. That's 600 people. We're going to get more for the second dose. So we are not being asked to withhold any doses for that second dose.
So you mentioned people that are at the testing sites are going to get it too in this first round?
The staff at the testing sites, people that are actually, swabbing people's noses, they're, obviously at very high risk of.
Right.
We haven't had any outbreaks there, but it's a safety thing. So.
Based on your discussion so far, how long do you estimate at least that 1A tier, how long will it take to get all those people covered?
It's going to take us probably the bulk of next month to really get it going. Again, it's a matter of ramping up the staff. We did get an additional grant to hire additional nurses to provide vaccinations, and we're in the process of allocating that money, recruiting and hiring for that.
Great, thanks, Doctor.
Thank you so much, Doctor.